Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Jill Sutton, a pediatrician at Terrebonne General Pediatric Care. Welcome to the show, Dr. Sutton.
Thanks for having me.
Well, I'm so glad you could be with us today. Let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Okay. I'm a board certified pediatrician. I've been here at Terrebonne General Pediatric Care for almost 9 years now. I did my training at LSU. I went to undergrad at LSU, my med school at LSU, and then I did my residency with Children's Hospital in New Orleans. And I'm just really grateful for the chance to interact with families and kids in our community and be able to participate in keeping them healthy.
Gosh, almost 10 years already.
I know.
Time flies. And now you have 3 children of your
Right.
own,
I've got
right?
3 wonderful kids,
Oh,
6, 3, and 1,
Oh.
and they're doing great.
I know that keeps you busy.
For sure.
Well, let's get into our conversation about childhood vaccines. I know there's a lot of questions people have as, parents are very, need to know information. So the first question is, why are vaccines so important?
So vaccines are very important because they protect not only the child who's getting the vaccines, but they also protect adults, they protect the elderly, and even in some instances, they protect unborn babies from some illnesses that can have some serious consequences or even some life-threatening effects.
And are vaccines safe?
Yes, vaccines are very safe. They've been around for a very, very long time. The first vaccine was invented in the 1700s, and since then, vaccines have only been getting better and safer, and the vaccines that we have now are super safe. They're super effective. I know there's a ton of misinformation out there that says that vaccines can cause autism, can cause infertility, can cause even childhood cancers, but none of that is true. None of that is based in any facts or evidence. Autism rates in kids that have been vaccinated are the same as autism rates in kids that have been not vaccinated. And so vaccines have been shown time and time again to be super safe.
Okay. And how do they help to protect children and the community?
So vaccines, in the most basic explanation of how they work, they introduce a protein to your immune system that either is from an inactivated virus or mimics a protein from a virus or bacteria, and your immune system reacts to it and makes antibodies. And it also remembers what that protein looks like. So that way, if you come into contact with that illness in the future, whether it be months or years down the road, then your immune system has that immune response kind of locked and loaded and ready to go to help you fight off that illness. And so if the more people in the community that are vaccinated or immune to a disease, then the more likely that community is to achieve herd immunity.
Oh, okay. That was my next question. And why is herd immunity so important?
So herd immunity is when enough people in a community are immune to an illness that it stops the spread of the illness in the community. And so herd immunity is really important because there are people in the community that either can't be vaccinated because they're too young, like newborns that haven't reached the age to be vaccinated yet. There are people that are immunocompromised that can't mount a good immune response to the vaccinations. And then there are also elderly people that are have maybe been vaccinated, but their immunity has waned over the course of their life. And so they rely on herd immunity to help to keep them protected from those illnesses.
That's important. What childhood diseases do vaccines prevent from?
So vaccines, there are childhood vaccines to protect from 18 different illnesses. So there's a lot of them. Just in the first couple of years, I'll just kind of name some of them. So there's hepatitis B, RSV, diphtheria, tetanus, pertussis, measles, mumps, rubella, Haemophilus influenza type B, pneumococcal disease, and that's just to name a few. So there are 18 different illnesses that vaccines can protect from.
Those all sound horrendous to get to. I wouldn't want to get any of those.
Not ideal, for sure.
For sure. How have childhood vaccines changed children's health over the years?
So in many different ways, every vaccine has its own story of how it's improved childhood health and the health of everyone in the community. But a few different examples that are kind of more recent that people may relate to. One being chickenpox. And so the chickenpox vaccine came out in 1995. So people born around that time or before that more than likely had the chickenpox. There used to be 4 million cases per year in the United States, and 10,000 of those cases were hospitalized, and anywhere from 100 to 150 usually people ended up dying from the chickenpox or complications of the chickenpox. And so now that kids are vaccinated, we really don't see the chickenpox at all anymore.
Wow.
And so this protects the kids, but then also when they're adults, because they never got the chickenpox virus, they're also going to be unlikely to get the shingles because it's the same virus that reactivates later on in life and causes the shingles, which can be very painful. And then also there is something called congenital varicella syndrome, which is whenever a pregnant woman would get the chickenpox, it could put her baby at risk for congenital varicella syndrome, which can cause some serious birth defects. So this one vaccine is an example of how children, adults, and unborn babies could all be protected. And then there's other examples with HPV, how it's seriously decreased the amount of cervical cancers and other kinds of cancers. And then there's also RSV, which is the most recent addition to the vaccination schedule. RSV is respiratory syncytial virus, and it is the most common reason that babies are hospitalized in their first year of age. And so this vaccine has only been around for a few years. It's not technically a vaccine because it just is a shot of the antibodies and their immune systems don't really respond to it, but it has been shown to decrease the incidence of infants being hospitalized with RSV from anywhere to 80 to 98%, which is huge.
Wow,
So it can be a real safety net, peace of mind for families whose babies get this RSV immunization, that if they do come into contact with it, they're a lot less likely to have serious effects.
One simple vaccine can do all that. So what is the recommended childhood vaccination schedule and why is it designed like that?
So the recommended childhood vaccination schedule is put out by the American Academy of Pediatrics, or the AAP. It is designed in such a way that every vaccine that is on there is where it is for a specific reason. So hepatitis B, there's a birth dose of that one because infants that are exposed to hepatitis B at birth are much more likely to have a lifelong chronic infection. And so giving that birth dose decreases the chance that they'll have that lifelong chronic infection. The MMR is given at 12 months of age for the first dose because they found in the studies whenever they were deciding where to put it that babies at 12 months of age had a more robust immune response to the vaccine than they did at a younger age. So they decided to put that one at 12 months. HPV is given at 11 years old because kids are already coming in at 11 years old for their other shots, so tetanus, meningitis, and so they get the HPV at that age as well because HPV is a sexually transmitted disease, and so you want to get that vaccine and that protection in before they're becoming exposed, before sexual activity becomes something that they're really becoming exposed to.
Right. So this is like scientific evidence, right?
Right. Yeah. So everything is there. It's where it is, not just based on, willy-nilly thoughts and feelings. It's all scientifically backed, researched to a T where everything is for a reason. And it also goes along to coordinate with your child's well child visits. And so whenever they're coming in for their wellness visits, they'll also be getting their vaccines coordinated with that. So that way you're not coming back and forth just for vaccines, you get it all done at one visit.
Right. And what are some common side effects that children may get from vaccines?
So for babies, most commonly, you're going to see fever, typically some low-grade fever, or some extra fussiness or a little bit of extra sleepiness after vaccines. For older kids, you may also see some low-grade fever, but they're more likely to have some muscle soreness or some redness and swelling at the injection site. But for the majority of kids that get vaccines, I wouldn't expect any side effects at all. They can get their vaccines and go about their day as usual. They can go to school, they can go to daycare. The worst part of it is going to be the needle stick. So once they get over that, then they can go about their day.
Pop at the end of that, so
exactly.
It's not so bad. Why do you all give multiple vaccines at one visit?
And so it's all about getting the child that protection ASAP and also coordinating the vaccines with the wellness visits. And so babies are exposed to germs. Their immune systems are being kind of bombarded from the second that they're born with all kinds of things to challenge their immune system so it can grow and develop and get stronger. And so getting multiple vaccines at one visit is kind of like no big deal for them to be exposed to those things and kind of challenge their immune system a little bit.
So give them all at one time.
Mhm.
So what do you say to families who may have gotten behind on their vaccines?
Say to talk to your pediatrician about it.
Mhm.
Talk to them about why you've gotten behind on the vaccines, why you might have any hesitancy about the vaccines, and then you and your pediatrician together can hopefully come up with something that that you feel comfortable with and that you can both get behind to get your child caught up on the vaccinations and get them protected.
hmm And what would you say to parents who are hesitant about getting their child vaccinated?
Say I fully understand. I mean, I get on social media too. There's so much
Yes.
misinformation and
much.
negativity out there about vaccines right now.
Mhm.
And so I would say to um, just be sure to check your facts. Whatever someone is saying on social media does not necessarily mean that it's true. There are a lot of people out there that are saying things as facts that maybe have no authority or
They're not experts.
background. They're not experts. And so it's really easy for people to check facts nowadays too. And so you can go to, your pediatrician, you can ask Google, you can ask ChatGPT. There are ways to easily get reliable information. You can kind of owe it to yourself and your family when you're making decisions about their health and make sure that you have reliable information.
Yeah.
Because a lot of the
Educate
stuff that's
yourself.
out there is just straight up not true.
Right. Well, good information there. Why are school vaccines required for attendance?
So school vaccines are required. They've been required for a very, very long time because of in school, your kids are sitting in a room with a lot of other kids for an extended period of time.
Mhm.
And that is where some of these illnesses can travel like wildfire. And so we used to see it with the chicken pox, wipe out whole classes of kids at a time for a little
Right.
while. And then we still do see it sometimes with the flu because the uptake of the flu vaccine is not super great. And so it can just take out a lot of kids from class for an extended period of time. But then this is also where these illnesses are spreading really quickly, and then kids are taking them home to their families, taking them
Yes.
home to their siblings, their grandparents. And so having these vaccines required for school decreases the spread and transmission of these illnesses a lot.
So what is the one main takeaway that you want our audience to know about vaccines?
To please check your facts. Check the things that you're hearing on the internet, from your friends, from your neighbors. Make sure that the information that you have is good, factual, scientific information. If you can't look it up easily, if you can't check a story or a fact that someone is telling you very easily on the internet, then chances are it's probably not true. And so
Yeah.
a lot of the stuff out there about vaccines is not true. They're very, very safe. They are very, very effective. And talk to your pediatrician.
Okay. Well, thank you so much for being with us today and sharing this helpful information.
Thank you for having me.
For more information, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks so much for joining us.